So we have the responsibility to establish the treatment protocols to decrease disabilities, to improve quality of life and reduce suffering. So what is cerebral palsy? Cerebral palsy is a contributor to childhood disability and non-progressive neuromotor disability originating from cerebral dysfunction. The prevalence of this disease is out of 1,000 individuals, 2 cases globally. So, causes of the CP is according to our sciences, Ayurvedic sciences, Bijadoshti, Agni-Mandita, and Garbhabadha and Prasava Karanas. And these are the other causes like prenatal, perinatal, and postnatal causes. So, so our case is to suffering from CP to explore the treatment domain and their outcomes. So this is a case of CP which came to our OPDs of 2-year child, and he was Hindus, and the main complaint was unable to sit, stand, and hold the neck, and globally delayed milestones and lethargic since birth. The history of the child was the mother was of 18 years old, and she experienced mental stress during pregnancies. Along with the preterm baby was 32 weeks of gestation, and normal vaginal delivery has been took place. And the weight of the baby was preterm, that was 1.6 kg. And he was also suffered from septicemia, convulsion, jaundice, delayed growth and development, SSCT and involvement. Multiple treatment received, but no significant improvement were noted. So these are the past history and treatment. He has taken baclofen, physiotherapy, and Botox injection before coming to our OPDs. These are the postnatal history. It was birth asphyxia, neonatal sepsis, and physiological jaundice was there. So we have just given the examination of CNS. Hypotonia was present. Muscle power could not be elicited at that time due to unable to follow the commands. And cranial nerves also had not been taken, but it was seen that hyperflexia was there present. And this is the suggestive and hallmark of CP. So we have also checked the fasciculation and irritability. It was absent. Later on, we have checked a muscle tone, muscle bulk, muscle power, reflexes, all these taken later on. These are the pictures we have taken. This is our science. We have taken the probability pathophysiology and its management. The dosa was Vatik dosas, and dosya was Asti Sandhi, Snayu and Kandara, and it has been severe quadriplegia, CP as a sequelae post-epilepsy. It has been diagnosed by some other hospitals. So treatment protocol we have planned. This is the symptomatic treatment, procedure-based therapy, Snehana, Swedana, Utsadana, Matra Basti, Shiroabhyang, Padabhyang, Shirodhara, Shiropichu, Rasayan Chikitsa, Medyabal Rasayan, physiotherapy, occupational therapy, education, and orthopedic surgery. So these treatments we have given. We have just given 5 sittings of treatment for 15 days with a regular interval of 3 months. So we have given the Samana Ausadhis along with the Shodhana Ausadhis. So therapies we have given like Shirodhara, followed by Shirobhyang, Utsadana, Sarvangabhyang, Nadi Swed, Pind Swed, and Matra Basti. This same line of treatment is given for 2nd, 3rd, and 4th sitting. Samana Ausadhi we have given Deepana Pachana drugs along with Sitopladhi Churn, Trikatu Churn, Gudachi Sattu and Stu Madhu, we will mix together, and we Anupana will give Madhu. Then we have given the Vacha Churn and Bilwadi Patra local application in the oral cavity. Sword Prasan, 4 drops daily empty stomach we have given, and Aswagandhadi Churn, half 1/4 teaspoon we have given, and Trifladi syrup we have given for 5 ml bedtime at night, and Brahmi Bhatti we have given half tablet daily. These are some pictures we have there. These are the before treatment and after treatments. What was we have seen in that? The muscle power we have seen that is also reduced. Then we have foot tapping. It was present that time. It was absent. Clenched fist was present and absent. Drooling of saliva was present that time, but now it is reduced. And sitting gait was present, but it is now less. So gross motor, fine motor, all these milestones has been achieved. Then head bobbing was present that time. It is absent, and irritability also correct. He was always taking nebulizations at that time, but nowadays it has been reduced. So last and least, we have the replace, insure, and call insure. These are our responsibility, and every parent is the responsibility for this thing. No doctor can replace the loving parents. Parents are the best for the managing your kids. Insure 20 minutes for your kid for walking up, bathing, toileting, feeding, and exercise and sleep. And call for actions, careless, support, and advocacy. Ensure your child's participation in almost all activities in their life. Be pleasant with your kid. Thank you.
Thank you, sir. Now, I invite the chairperson and panel members to ask any questions if they have.
It's a very good case presentation you have made, and it's really very satisfying to see the results that you have obtained in this particular case. Uh, is there any way by which you could have measured the CP in terms of physical disability and then scoring, some sort of scoring done prior to the treatment and then scoring done after the treatment, which you have just mentioned, done a very good job. But had it been done on a scoring some method which are available, so that would have really made your case that much more stronger and better. That's just a suggestion, and probably you could include it in the next test.
Okay, sir. Okay, thank you, sir.
Now, I invite the second presenter, Dr. Supriya Mishra ma'am, on the topic Effect of Panchakarma Treatment in Guillain-Barré Syndrome with special reference to Sarvanga Vata, a case report.
Namaskar everyone, myself Dr. Supriya Mishra, second year PG scholar from SDMCH Hassan, Karnataka. Today I am presenting effect of Panchakarma treatment in Guillain-Barré syndrome with a special reference to Sarvangat Vata. So, as we all of know, Guillain-Barré syndrome is an acute and autoimmune mediated polyneuropathy characterized by progressive motor weakness and sensory disturbances. Motor recovery can be slow and incomplete. Can be correlated with Sravangat Vat because the Lakshanas are Gatra Sfuran, Gatra Bhanjan, Vedana Sfutan in Sandhi, which is very similar to Guillain-Barré syndrome. One among, that Sarvangat Vat is one among of Nalatmach Vyadhi, in which Vata Prakop associated with Dhatukshay and Sanskrit dosha like Pitta and Kapha. Patient's main complaint was he was 50-year-old male working in Dubai, progressive weakness in upper and lower limbs, inability to stand or walk without support, and or numbness in the toes. He was well before 20th April, and then he got fever, followed by diarrhea and progressive weakness in the lower limbs, and later extended to the upper limbs. There is nothing significant in family and personal history. In Dubai, they have treated with immunoglobulin treatment and corticosteroid therapy that provided temporary symptom control but did not result in the motor recovery. So they discharge and they suggest physiotherapy to the patient. From there, patient directly come to our hospital. So there we had examined the motor system and sensory system. Sensory system was intact, but motor system has these problems. In diagnostic findings, we found spondylodegenerative changes, thickening and enhancement of chorda equina nerve roots. And nerve conduction study, we found mixed demyelination and axonal motor deneuropathy in both upper and lower limbs. And CSF total protein also increased 646 mg per dl. So we had started for 3 days Sarvang Parisheka with Dhanyamla, Padabhyang with Mahamasha Tela, and Guda Pichu with Mahamasha Tela. After 3 days, we added Sarvang Utsadhan with Yashti Madhu Tela, Matra Basti with Mahamasha Tela, and Western with the Mahamasha Tela on bilateral lower limb. Then we added Mustadi Yapan Basti, and after that, the remarkable change we have seen that patient can able to stand without support up to 10 minutes. Then we provide extra support. We had given a Brahma therapy or Santarpa Chikitsa. There we have given Shashtika Shali Pindasveda, then Godhum Pindasveda, then Mash Pindasveda, then Navadhani Pindasveda. After that, patient can walk very slowly without support up to more than 30 steps. Then we stopped all Anta Parimarjan Chikitsa. We kept only Bahy Parimarjan Chikitsa, that is Sarvang Abhyang with Shashtika Shali Pindasveda, Udvartan with Parisheka, or Sarvang Abhyang with Upana, according to climate condition or patient condition. When patient got discharged, that time patient can climb stairs without any person support. And the HITAYU disability score, which is an international score for GB syndrome, that improved from 4 to 2. Internal medication, we had given Yashti Madhu, then Bala capsule with Kumar Bhanaras, and after that we had given Bhargav Proktorasan, then Amrit Prashikrita and Brihatva Chintamani. So I am showing the videos one by one. When patient came, and that time, see, whenever we had given treatment, this type of patient, we never given stick to the patient. So he was trying, in first video, he was trying to just stand with and without support. In next video, he started walking with 2 to 4 person support. Next. Next. This is the video of before 1 week of discharge. Patient can walk without any support, but he can't run. That change needed yet. So we kept him only on exercise. We are not giving right now any internal or external treatment. Next. So as we all know, along with Vata dosha, Kapha Avran was there. So Aptarpan Chikitsa was followed initially as Udvartana, which helps in removing Avran of Kapha and alleviates the Vata dosha, improves blood circulation. Sarvang Abhyang with Mahamasha Tela along with Patra Pindasveda is Vata Kapha Hara. After removal of Kapha Varan, Santarpan Chikitsa was provided with Shashtika Shali Pindasveda, Godhum Damdhani Pindasveda. Then Matra Basti with Mahamasha Tela, Balamul capsule, because it is Ojo Ayurvardhak, Balya and Brimmar. So we had given is Basti, especially Yapan Basti is indicated in Avran condition. In this disease, Mustadi Yapan Basti is given, which has the properties of Mans Balajan, Shulhara, Janu Uru Janga. Then these type of cases, we can say that it increases our confidence. The connection between Pittadhara Kala and Vajradhara Kala got proved, and confirming that Bahiparimarjan Chikitsa and Shodhan Chikitsa diagnosis can complement and enhances the effectiveness of treatment of neurodegenerative cases. Last, I would like to thank Dr. Ashwini Kumar M, our professor and HOD, who treated this case, Dr. Mulidhar P. Pujar, Dr. Lohit B. Dr. Sitaram MS, and Dr. Shamim Banu. And thank you for giving me such a wonderful opportunity.
Thank you, ma'am. I now invite the panel members to ask any questions if they have.
I would like to congratulate. I would like to congratulate the presenter for the very good presentation.
Thank you.
One important thing is, as you know, the role of Ayurveda, particularly in pacifying Vata dosha.
Yes.
Sharirjanam doshanam kramena paramaushadam vastre bireko bamanam tatha telam kritam madhu. So in this perspective, role of the Basti is supposed to be very important.
Yes.
So why you have selected Basti or not?
Yes, I have selected Mustadi Yapan Basti. That's why I told after giving Mustadi Yapan Basti, patient was able to stand. That you have seen that he was holding the grill of window.
because there is association of the kapha dosha also.
Kapha dosha
That's
also?
why initially
Yes.
for removing the avaran, apatarpan chikitsa is needed.
Yes.
No doubt.
Yes, sir.
But the basti chikitsa is supposed to be very important role
Yes, sir.
in this particular thing.
Yes.
That's very good.
Thank you.
Congratulations.
Yes,
Good.
sir. Thanks.
Especially cheat must be the important too, because cheat is the jivni padarth, or any oil you can taking, either Mahanayan tel or whatever oil you taken. Sale rationalization of the medicine you must have to be focused, not to use much medicine. Ideally 3 or 4 medicine is enough. Even ashwagandha, any Swarna Muktadi tablet because Swarna is there. Or you have to don't forget that GB syndrome is due to viral also, because in early position surgical case is also there. So Nimhans Hospital have integrated this one, National Institute of Mental Health and Neuroscience. And after the surgery, when they recover, then they not recovering by allopathic medicine. So they boost thrown to Ayurvedic section, and whatever you process you do. But we use the rationalized medicine, Swarna Muktadi tablet, Ashwagandha tablet, and any cheat basti. Because cheat basti is junior padarth. If it is coming out, not coming out, or anything, it is not going to be create harm, and the patient is going to within 20 days, patient is able to walk. And you soon work because 126 of every month DMD over on all the muscular dystrophy we are arranging OPD, and this GB syndrome the daily we are as per the need. But you have to be rationalize the medicine, 3 medicine maximum. One sir told not need to make more than 5 or more than 2-3 medicine. It is a misuse of the property.
Now I invite Dr. Netravati B. Aruni ma'am for a presentation on the topic bidirectional association of lifestyle with special reference to PCOS, a case study.
A very good evening, everyone. Myself, Dr. Netravati B. Aruni. I'm a PhD scholar from the Department of Prasuti Tantra and Sri Yoga, Shushruta Ayurveda Medical College and Hospital, Bangalore. Under the guidance of Dr. Mamta KV, I have taken the case of bidirectional association of lifestyle in PCOS with special reference to Pushpagni, a clinical case study. So in this case, we have most of the time we have seen that the PCOS means when we are going for the survey study or everywhere, we will see across so many of PCOS cases. So how we have to treat? So most of the time we will tell that there is a lifestyle is going to impact it for this PCOS. Later it will become as one of the main cause for the infertility. So here is the case, a patient of 29-year-old female Hindu. She is working as a teacher at Navnagar, Bagalkot, and she is married since 2 years. She had a complaint when she came to our hospital. She had a complaint of anxious to conceive since married life of 2 years and irregular menstrual cycle. And there is a history of amenorrhea since 2 months associated with excessive hair growth and weight gain or difficulty in losing weight since 1 year. So after this all, she approached our hospital for the management because she underwent before that there is a menstrual withdrawal of bleeding with modern medicines like tablet merprate 10 mg for 1 TID dose, and along with there is a ovulation induction treatment also they have done, followed for since 1 year also. So because of these medicines, after taking these medicines also, there is a delayed progression of the conception. So she approached our hospital for the management. So in that case, there is no any history of thyroid dysfunctions, which is mainly related for the PCOS also. And there is a family history also, there is nothing specific has noticed. In Vaiktika Ruttanta, there is the appetite was slightly reduced and diet is mixed, bowel is constipated. Habits, there is no any habits of tea or coffee intake, followed by there is a lower middle class family history was there. In the menstrual history, the main thing in the menstrual history we have to notice in the patient, what is the consistency of the bleeding, color of the bleeding, and is there any smell is associated, or there is mainly nowadays we have to rule out the duration of the bleeding and interval of cycle, the amount of blood loss. It's mainly through the PBSC, that is pictorial blood assessment chart. So in this chart, the patient was, the amount of blood loss was 20 ml, and she's having approximately only the 3 days of bleeding was there, that is a scanty menstrual cycles. So in this case, the Chikitsa Ruttanta also, she has underwent for the modern allopathic medicines, Meprate for ovulation, Lectros, Proginova, and Ferrous XT also. So coming to the Samanya Pariksha, the patient was obese, the weight overweight, the BMI was 30.8, and the nourishment was overnourished. In coming to the Ashtasthana Parikshas, there is a Nadi, it was a Pitta Kafaja Nadi, Mala is Vibandha, Mutra is Prakruta, Jiva Aliptata. Coming to the Dashavida Pariksha, the Prakriti is Vata Kafaja Prakriti, the doshas are Vikruta as was Rasa Vata Kafa, sorry, there is my mistake, there is a Vata doshas involvement was, Dusha is Rasa, Rakta and Artava, Sara is Madhyama Sara, Samhana is Asamata. Coming to Pramana is, there is a Pravara, and in Vayama Shakti it is a Avara. So the Samsthanika Pariksha, that is normal study, and laboratory investigation. Here the ESR is raised to 36 ml for first hour, and her random blood sugar was 152. So again we went for HbA1c, it was 5.5. The torch is negative, and the estradiol was 35.5. Progesterone was 0.3. So these are the reports of her before treatment. So in USG abdomen, it is clearly mentioned that the uterus is normal size. It was 7.7 into 2.2 into 2.9 centimeter. But in ovaries, there is a slightly polycystic ovarian changes they have mentioned. The ovaries values are also increased. The right ovary was 3 into 2 centimeter, and left ovary was 3.1 into 1.9 centimeter. So Nidana Panchaka, when I asked for the patient, she told that she is having a habit to intake of more junk foods, followed with Vegadharanas, and her Ahara Vihara is completely hampered because she is working and she is not taking the food proper on time. So considering these all are Nidana Panchakas and all, so completely her the Dusha was completely involved, Rasa, Rakta, Mamsa, Meda, and Srotas are Rasa, Rakta, Mamsa, Meda, Asti. Why I have taken here the completely the Rasa Rakta? Because when we are going to tell the patient about her lifestyle and all Vegadharanas, so it is completely impacting her. While taking an example of dehydration only, so this dehydration, so coming to the anatomical part of the reproductive system, the uterus is the organ, is a muscular organ. So it is mainly seated in between the Mutrashaya and Purushava Srotas. So bladder is front organ and the intestines are the in between the uterus is going to seat it. So if you are suppressing the urges or kind of any dehydration only when we are taking the examples. So in the dehydration, what happens? Especially it mainly affects on the kidneys. Then later the muscles which are going to be damages. So when it is a muscular organ, so considering from the uterus to the fallopian tubes also, there is a peristalsis movements. It mainly comes through the vayu. So considering this also, when the muscles are going to damage, it is not getting a good nourishment. Because of that, in the ovary, the theca cells and granular cells are not getting the proper nourishment. So because of that also, one of the, there is the fluid which is needed for the ovulation also, it is not going. So because of that, the endometrium is not going to develop because the theca cells produces the more androgens and the granular cells produces the and converts the androgens into the estrogens. So these affect impacts on. So that's why I have taken this PCOS patient as a Pushpagni. Why? Because when coming to the Kashyapa, he mentioned that Ruta Pushpa, it can be taken as a annulatory cycle, and Stula is mainly refers to obesity, and Lomasha Ganda refers to the hirsutisms. So clinical symptoms of PCOS, as we know, so most of the time we will tell it's the PCOS means there is a hormonal disruption, weight gain and obesity, menstrual irregularities, and later it impacts on the fertility. So before going to night, sorry, I'm taking some 2 minutes. So the pathophysiology is more important treating any kind of PCOS patient or infertility patients, because when we know the pathophysiology of the patient, So here in this, the chemicals, whatever the junk foods chemicals are there, there is a pathways that can affect on the endocrine system directly. So because of that, there is a excess intrauterine androgens growth will be there. So these androgens, which produces more ovarian steroidogenesis. So because of that, there is a more testosterone growth, which mainly acts, there is a complete, means the LH should be in normal range and FSH. So in this PCOS case, the LH is going to increases and FSH is going to be decreases. So because of that, there is a complete, there is no any complete maturation of the follicles. So later only in PCOS, we are seeing in the scanning report, there's a cheese kind of structures. The PCOS sisters are going to be growth. So these patient, these pathophysiology I have seen in this patient. Okay. Yeah, in this treatment, I have taken so Deepana Pachana with Chitrakadivati, Udvartana with for 3 days, and Sarvanga Abhyanga with Mahanarayana Taila, and followed with Vamana, have ruled out. And in medicines, like after while going to discharge Kanchanara Gugulu, Varunadi Kashaya, and capsule Falavo, that is a Falagrutas capsule. This Deepana is mainly for the to free from the doshas from the Dhatu, Srotas, and Ashaya, and Snehana, Svedana is mainly to passes the dosha to, and Patya Apatya, this is the before and after treatment. Interval of cycle is 61.
Now conclude.
Okay. So after this treatment, the patient was conceived, and her USG scanning report, there is a single live gestational sac with 5 weeks of 6 days with good cardiac activity. And she is now having a 2-year of child. And she said that she was not trusting the Ayurveda, but after the conception and all, she said that she started to believe, and she referred some patients also. So this is the last final report of my patient. So I would like to thank my college principal, sir, and my guide. And I would like to thank for giving me opportunity to present my case study. Thank you.
Thank you, ma'am.
Yes, congratulations for your very good presentation. But remember this thing, number one, the good presentation is you must know your subject thoroughly. Number one, उसमें मैं आपको as a teacher I am giving 11 out of 10 marks. You have got good knowledge of your subject. Number second, you must know your time. That is very important. In how much time you will have to conclude the whole paper. Or third one is that you must know your audience. It is not necessary to explain each and every point over here. That's why congratulations once again for your good presentation. Any question from the audience?
It's really wonderful to see such wonderful results from the therapies that you people are giving. So congratulations to you for having produced this result in this particular case, and good case presentation. Thank you.
One thing I would like to ask you, Yoni Vyapad is described in Ayurveda in thorough detail. उदावर्ता तथा बंध्या विप्लवत प्रपृता बातला चित बातो था पित्तो था रुद्रच्छरा बामनी संसनी चा पुत्तग्नि पितला चया अत्यानंदा चायोनि करणी चरणादम महती च सूचवक्त्रा सर्वज्ञ त्रिदो सजा. In 20 types of the Yoni Vyapad, could it be possible to place this disease? Yeah.
We can take as a Rajaska. So when coming to the commentators of Chakrabani, he told that the Vataja Yoni Vapat also can be taken as a Vataja Atavadushti or Vataja Asrukdara also. So in sometimes in PCOS patient, one who is having intermenstrual bleeding with excessive bleeding, so that kind of cases can be correlated with Rajaska Yoni Vapat.
All right. So,
Okay. Explaining the modern part, because modern part is most of people know. Ayurvedic part is unknown by most of people, so you have to first start from Ayurvedic part and explain on the parameter of the commentator, and Chikitsa part is the must. And you first you not respected time, and whatever you have to be speak, you ignored. So in future you have to be treatment part, you must have to focus, and Ayurvedic part. Ayurvedic part.
I invite Dr. Arjun Sashi Kumar, sir, for his presentation on the topic Ayurvedic management of psoriasis with special reference to Sidma Kushta.
Good evening, one and all, present on the dais and off the dais. Today, I'm going to present a case report on the Ayurvedic management of psoriasis, a case report. Myself, Dr. Arjun Shashikumar, Associate Professor in the Department of Panchakarma, GGIMS, Gorakhpur. Moving on to the introduction, psoriasis is a chronic autoimmune condition that causes rapid buildup of skin cells, which causes scaling of the skin surface. Typical psoriatic scales are whitish, silver in color, and develop as thick and red patches. According to World Health Organization, some studies estimate that about 75% of psoriatic cases are diagnosed before the age of 46. There are different types of psoriasis, such as plaque psoriasis, guttate psoriasis, pustular psoriasis, inverse psoriasis, and erythrodermic psoriasis. The most common type of psoriasis, as we all know, it's plaque psoriasis. The symptoms are red raised, inflamed patches of the skin with whitish silver scales. Psoriasis is not a contagious disease. In the case of psoriasis, white blood cells known as T cells mistakenly attack the skin cells and results in the formation of plaques that are most commonly presented in the psoriatic cases. According to Ayurvedic classics, psoriasis may be correlated with Sidma Kushta. The characteristics of Sidma Kushta are dryness externally and moistness internally. It will be presented along with whitish, coppery scales over the skin, and there will be production of dust when rubbed over the skin surface. It is clearly mentioned, Bahirruksham Andasnigtham Rejaktired, and it is presented firstly over the scalp, Murthakaya. The predominant dosha of Sidma Kushta are Vata and Kapha, and the protocol which can be followed in Sidma Kushta, Vibana Pajana, Snehapana, Shodhana, and Shamana. Moving on to the case report, a male patient aged 22 years from Tumakuru in Karnataka presented with the complaints of skin lesions of the scalp, and it spread to upper limbs and trunk since 8 years, associated with itching with severe appearance of reddish skin lesions. The patient was apparently normal 8 years back, and gradually the complaints developed first over the scalp, and then it spread to bilateral upper limb and trunk. It got aggravated 6 months before visiting the Ayurvedic hospital, and meanwhile the patient had homeopathic medications and it recovered, and again stoppage of homeopathic medication, again the condition aggravated. There is no significant past history and family history, and the psychosocial status was good. Moving on to the personal history, bowel condition were normal, good appetite, micturition and sleep were normal. The vitals were within normal limits, weight 65 kg, height 182 centimeter, BMI 19.4. All the lab values were normal except ESR, as it's an inflammatory case, ESR was slightly elevated. Moving on to the general examination, the patient was lean built, fit, looking well dressed, with anxious face, no pallor or icterus or cyanosis or clubbing or lymphadenopathy and edema noted. Moving on to the systemic examination, the site of lesion was scalp, bilateral upper limb and trunk with reddish black discoloration. Configuration symmetrical, multiple circular plaques was presented associated with itching, respiratory system and cardiovascular system were normal. Moving on to the Ayurvedic examination, dosha was Vada Kabaja, Desha Anuba, Bala Madhyama, Kala Sharad, Agni Madhyama, Prakriti Vada Pitta, Vaya Yavana, Sattvam Avara, Satmyam Madhyama, Sara Pramana Samhanana Madhyama. And considering all the presenting complaints, Nidana, Samprapti, and Lakshanas, the patient was diagnosed psoriasis, and it may be correlated to Sigma Kushta. Prognosis was Yapya. These internal medications were given like Mahatikta Kashaya and Kaishora Guglu before food, Aragodharishtam and Khadidarishtam after food based on the rationale, Amapajana, Agni Dibana, Anulomana, Kapavada Shamana, Kushtagna. Protocol followed was Shodhananga Snehapana with Mahatikta Grada up to 7 days. Samik Snikta Lakshana was noted on the 7th day. 3 days Vishramakala. During the Vishramakala, Abhinga and Ushma Sweta was given. Siddhartha Snana Churna was used externally during bathing. On the 4th day, Virajana was given with Trivrit Lehya, 60 gram, Anupana, Trifila Kashaya. Outcome assessment, clinical features after treatment, itching and lesions reduced, systemic examination, plaques associated with itching reduced significantly, formed into dark pigmentation of the skin. Lab findings, ESR which was elevated, reduced after the treatment. This is the pictorial demonstration before treatment and after treatment. Moving on to the discussion part, the line of the treatment in Kushta are Nidana Parivarjana, Snehana, Swedana, Prakriti Vikadana, Shamana. In Samprapti, Agnimantya and Ama played a major role. Improper Agni and irregular food habits led to Ama, vitiated Vata and Kapha dosha, Srodha by Sangha and Vimarga Gamana, and finally Dosha Samudra in Amasya got Sthana Samshraya in Tok. Shodhana is very important in the management of Kushta as it is told by Acharyas. Without doing Shodhana, by using Shamana procedures, moving on to the conclusion, after 4 months of medication, all the symptoms had recovered. Proper food habits, Dinacharya, Rithucharya, and Shodhana were advised to the patient. These are my references. Thank you.
Congratulations for your very good presentation. One thing is very important. While we are correlating any Western concept to the Ayurvedic medicine,
Yes, sir.
we cannot translate it because the concept of Western medicine is entirely different.
Yes,
Number one. Number second, though it might be having striking resemblance with a particular entity, here 3 entities are there: Kitiv, Ekakusht, and Siddhma.
And Sigma Kushta. All these actually all are Vata Kapacha.
Better you must diagnose the disease.
Yes.
Either on the modern line, you have diagnosed the final disease as a psoriasis.
This
The psoriasis is correlated according to symptomatology as Siddhma, according to your concept.
yes, yes.
Is it there?
Yeah.
So don't try to translate it,
Yeah.
because you
Only
must
that name is
keep this thing in the mind
yeah.
while you are presenting a thing. Several studies have been conducted in different centers of the country, right from Gujarat Ayurveda University Jamnagar, Banaras Hindu University Varanasi, and NIA Jaipur.
Yes.
So many studies are done. Somebody they correlated as Ekakusht, some Kitiv, several things are there. This type of the correlation is very important for guiding the further students to do such type of the work. Thank you, Kongchal.
Thank you, sir.
Thing is, line of treatment you completely ignored because 2 mistakes were there. In a Kushta Roga, you have to be must give Baman. Already Masat Mas Pakshan Chardam Cha Masat Virechanam. You Chardam you not given, and Virechan you given the first line of Virechan of Snehan Swedan Vantaya Dadyad Samyak Virechanam. अन्यथा ह्यो चितित श्लेष्मा ग्रहणी आच्छाद एत कफ ग्रहणी गद क्रीडमतम। अगर आप वमन कराकर नहीं देंगे तो वो जो है ऊपर का कफ जो है ग्रहणी को आच्छादित करके ग्रहणी गद ग्रहणी का रोग स्थापित कर सकता है। आप उसके लिए क्या व्यवस्था किया? आपने तो पूरे लाइन ही बेलाइन करके ड्रिल करके ट्रीटमेंट कर दिया।
control of the disease is entirely different thing. But the recurrences of the disease is very important. Yes. So to control whatever he narrated this thing, to control the disease, to cure the disease, you will have to keep this thing in the mind. Yes. For the proper cure of this.
Okay, sir.
Now, I invite Dr. Ashwati Narayanan ma'am for a presentation on the topic Management of Pittaja Oshta Prakopa, a case report.
A very good afternoon to one and all present here. So today my presentation is on Pittaja Oshta Prakopa, a case report. So Oshta rogas are a set of diseases which occurs in the lips, and it is one of the 7 Mukha rogas, and they are explained in Nidanasthana in Sushruta Samhita and Chikitsa in Chikitsasana Sushruta Samhita respectively, and in Ashtangridaya the references can be found in Uttaratandra 21st and 22nd chapter respectively. So coming to the Lakshanas, Achitau Pidagabistu, Sarshapakriti Birbrisham, Sadaha Paka Samsravo, Nilau Pitauch Pitadaha. So lesions or boils can be found in the lips, which resembles that of mustard seeds, and there will be discharge, which will be associated with burning sensation, and there will be yellowish discoloration along with it. Okay, so the chikitsa is Jalukavacharanam, Pitta Vidridi Chikitsa, and along with this Pittaharana, which is Rechana. So coming to the patient information, a 35 years old male patient had come, and his profession is salesman. The chief complaints were small eruptions in the lower lip with uneven margin, spreading in nature, and associated with yellowish red boils, along with pain and burning sensation over lower lip, which has aggravated since 2 months. So there was no significant data about family history and past treatments. He had been suffering with the same condition since 2 years, and he had undergone multiple treatments, allopathic and both Ayurvedic, but he didn't get any promising results. So he has approached our hospital. So as you can see the case, you can see Achitau Pidaga. There are spreading lesions or boils. Sadaha Paga Samsravo. There was discharge, which is little yellowish reddish in nature, and the patient was having burning sensation. Coming to the clinical findings, all the vitals were normal, and there was no abnormality in respiratory and circulatory systems, and digestive system appetite was seen to be reduced. Coming to the Dashavida Pariksha, the Prakriti was Pitta Vadaja, and the Vikriti was Vata Pittaja, not Pittaja, Vata Pittaja. And Sara, Samhanana, Pramana, everything was found to be Madhyama, and Vyayama Shakti and Ahara Shakti was Avara, which means poor. So the diagnostic was another thing, the symptomatic subjective complaints, and all allergy and blood routine were normal, and all RBS and urine analysis were also found to be normal. Coming to the treatment, the medicines I used was Guduchari Kashayam, Avipatti Churnam, and Grab capsule internally for 21 days, and Oshta Lepna with Pitaka Churna. So these are the dose and Anupana along with the medicines. Now coming to the follow-up, after 21 days of treatment, patient was completely cured, and the lips were of normal color and appearance, and we had done a follow-up of 15 days interval for 3 months to inquire about recurrences, but there was no such complaints found. So this is a picture of after treatment, after 21 days. So you can see both, comparing the both appearances. Now coming to the yukti of the treatment. So here, even though in an outline it seems that it is Pittaja Roga, but actually the culprit is Vata. Okay, how? So while we were examining the symptoms and the history, like means Nidana, we understood that Vata Prakopa is definitely there. Because of his profession, which is salesman, and the Nidanas which he was doing, Vata has achieved a Prakopa Avastha, and it is taking Pitta from its Swasthana to other Sthana. So in this case, it was Oshta. So in Ashyapagasha, the concept is the Pitta here is actually Prakrita Avastha. But after it has traveled to another Ashya, it has become Vikrita Avastha. Okay. So my yukti was
to bring about the Pitta Rejana along with Vata Anulomana and Agni Deepana. So the medicine which I used was Avipatti Churnam. So in this, if you see the Falasruddhi, you can see Alpek now, and we can use for Taba and Ama. So how come? So we know the treatment modalities to bring back the dosha from Shaka to Koshta. Vridyat, Abhishandanat, Pagat, Shrodhamukha Vishodhanat, Vayoscha Nigrahat. So here my yukti was Vayoscha Nigrahat. So Avipatti Churna was used to bring about Pitta Rejanam, Vatanulomanam and Agni Dipanam. And second drug was Guduchari Kashayam, Pitta Shleshma Jwara Chardi, Daha Trishnaknam Agnikrit. And Daha and Trishna will be reduced. And Grab capsule was used for Vranaropana properties as it contains Pranapahairas. And Pitaka Churna for local application and local Shamana of the Vrana, I used Pitaka Churna along with Madhu, which is again a Vranaropana in nature. Coming to the dietary and habitual, so all Abhishandya Haravas, I asked to avoid the patient to avoid those. So concluding my presentation, it is from another reference, Kalpavriksha Kamadhenu, Anayasena Maranam, Vina Dainina Jeevidam, Dehime Kripaya Shambhu, Tvai Bhaktim Achanchalam. So in the first line, Anayasena Maranam, Vina Dainina Jeevidam. So what is it? A peaceful death and a misery and life without any miseries, living without miseries. For achieving this, Hitayu, our national seminar, is the best way. So just follow Ayurveda and we'll achieve both of this. Thank you.
I request the panel members to ask any questions if they have.
Hello. Dr. Ashwati, very well presented. I just wanted, if you could, did you ever think of doing a biopsy in this particular test, particularly to rule out, benign and malignant?
Sir, actually, since 2 years, he is suffering from the condition, sir. So almost all checkup has been already completed. So allopathic and both Ayurvedic. And in Ayurvedic itself, everybody were concentrating simply on Pitta dosha, Pitta hara. So he was not getting result. So when I tackled Vata there, I got a very good result in the case.
That's very nice. You were so confident, you proceeded and got very nice.
Thank you.
दोषों को शाखा से कुष्ठ में लाने के लिए जो आपने उपाय बताए, वृद्ध्या विषंदनाथ पाकात स्रोतो मुख विशोधनाथ और
वायुष्य निग्रहात,
शाखा मुक्तः मला कुष्ठम यांतो वायुष्य निग्रहात. तो वायु निग्रह. तो मैं ये कहना चाहता हूँ कि once the pitta is in the normal condition, for example in the case of the pitta, while we are talking about the hydrochloric acid, when it is in the stomach there is no pain, there is no burning. Gastrointestinal reflex, a gastroesophageal reflex, GI, in that condition patient is having burning sensation in the throat.
Yes, sir.
Similarly, once pitta is the normal condition, we are not specifying pitta over there.
Actually, the concept you are telling, I will correlate it as dravadaha vriddhi, the guna of drava, pitta. Pittam sasnehati ikshoshnam lagu visram saram dravam. If that dravadaha guna is increased, the patient will definitely have amla pitta kind of presentation with sore belching. But that history was not there. He had Agni Mandya. So what has happened is the pitta, which should be in its sthana, has been displaced from its there. And he's having Agnimadya along with it. So I took it in a Vadahara, Pittahara line of approach.
Very good.
Thank you, ma'am. Now I invite Dr. Abhijit sir for his presentation on the topic imperativeness of lifestyle modifications with Ayurvedic medications in the management of non-alcoholic fatty liver disease, a case report.
सर ये है ना, ये आगे जाएगा इसके लिए.
Good evening, judges. Good evening, one and all. My topic is imperativeness of lifestyle modifications with Ayurvedic medications in the management of non-alcoholic fatty liver disease, a case report. So NFLD is the most common chronic liver disease in many parts of the world, including in India. Available data suggests that approximately 1 in 3 adults or children having NFLD in India. The reclassification of NFLD as MASLD, metabolic dysfunction associated steatotic liver disease, has been informed, and it was under approval from WHO. So due to this high prevalence, India is the first country in the world who included NFLD in the national program. Now, as at present, there is no FDA-approved therapies for the treatment of NAFLD. Hence, this remains an area of active research. Lifestyle changes and dietary modifications are the foundation of NAFLD. Many studies indicate that lifestyle modification can improve serum aminotransferase like SGLT and hepatic steatosis with loss of at least 3 to 5% of the body weight. Now this case presentation, patient information, 55-year-old female patient with pain and distension of abdomen, loss of appetite, dizziness, dryness of mouth, headache, shortness of breath, severe since last 3 days, and she was having some abdominal discomfort, loss of appetite, shortness, etc. since couple of months. The history reveals that she is a regular non-vegetarian who often practices adhyasana, frequent eating, and she was not following any rules of matra, kala, etc. of the meals. Her diet contained more oily fried food, less fruits and vegetables. So often takes dinner at 10 to 11 p.m. and almost her salt intake was 12 grams per day. There was no past history, family history and relevant surgical history. And in general examination and BP was 150/100 and she was not a known case of hypertension. Then clinical findings, right lumbar pain on palpation with a distended abdomen was there. Ashtavida Pariksha, Jihva was Alpalipta and Sparsha was Ruksha, all other was normal. In Dashavida Pariksha, Prakriti was Vadapita, Trudosha Virgiti was Deen, Ahara Shakti and Vyayam Shakti was Avara, all other are Madhyama. Then diagnostic assessment, hepatomegaly, moderate fatty liver, that is grade 2, mild ascites was there, SGOT 62.7, SGPT 70.4, and there was additionally anemia and thrombocytopenia was there. GRBS was normal. Now, the medicine we have given is Drakshadi Kashaya 20 ml BD before food with Ayurvedic Churna 3 gram BD before food with Kashaya. Tablet Punarnam Mandura 2 BD, Amricure DS 15 ml after food, Platensa 2 BD after food, Chitrakadi Gurika 2 TID after food, and Gomudra Asava 20 ml after food. So lifestyle modification prescribed 3 main meals and a proper time and approximately moderate quantity. Overeating and heavy meals are restricted. In between 3 meals, if she required, she are allowed to take vegetable salad or fruits, that is 1 before noon, and green gram soup 1 afternoon. Then normal salt was replaced with Saindava Lavana and limited up to 5 gram per day. Restricted all type of fried, fermented, packed food, bakery food, and she was allowed to take mustard oil and cow oil, but should not heat it and use. Dinner by 7:30 p.m. was given, and the follow-up outcome will be like in the first follow-up she got significant symptomatic relief. Then in the second follow-up she got almost complete symptomatic relief. But while considering the hepatomegaly, grade 2 fatty liver, ascites, and elevated SGOT-SCPT, the medicine was continued for 1 more month. So third follow-up visit 2 months later, she was completely devoid of symptoms. So stopped the medication, but still the lifestyle modification was continued for 6 months. Again, in the fourth follow-up after 6 months, USD, SGPT, SGPT, CBC all returned normal. So this was a treatment timeline, and this was a result, like symptoms like pain, distension, abdomen, loss of appetite, dizziness, dryness, everything become normal. USG was there. There was no diagnostic pathology seen. SGOT, SCPT are elevated, which become normal, and blood pressure was there. It become normal. Hemoglobin was 9.9, become normal, 15.5. Thrombocytopenia 93,000 become 2 lakh. TLC was elevated, which become normal. Body weight was 58, become 6 kg reduced. This was the USG before, and this was the USG after. No diagnostic pathology seen. And this was the SGOT, SCPT after treatment become normal. Hemoglobin and platelet count become normal. So discussion, the
biopsies, acne correction, metabolic correction, Kamala treatment, Lakshanika Jigsa. The Lakshadi Kashaya was indicated as it is Murcha, Daha, Srama, Brahma, and Kamala. It is indicated directly. So, and Draksha is also a proven drug for liver damage. It is the Musta Herbera Kashmiria, which is a content having Divanavajana property. Gambari is having Amashulahara, so she is having abdomen pain. Then it contains Patmaga, Vedana Stavaga, Amavishan national property is having by Sariba, Ushida is Ranashodaga and proven, Ayurveda Churna, a carminative antispasmodic and colic effect, Divana Vajana Ushada, Vedana and Rejaga Shodahara property. So in this case, there was a mild ascites. So Avivatikara Churna acts as a Nitya Virajaga also, and it was a proven for a drug in NAFLD. So Punarna Mandura, Panduroga, Dibana Vajana, Shodara, Yakut Balya, antioxidant and hepatoprotected. Chitragadi, Dibana Vajana, so metabolic correction, and it is also proven for laboratory positive changes in the liver enzyme, improved lipid profile. This medicine is effective in the management of NAFLD. Gomutra Sava, Gomutra is Medohara, Kamalahara properties, and Gomutra is antioxidant, anti-obesic, and anti-diabetic hepatoprotective protein. Platensa and Amlicure was given. Platensa for thrombocytopenia. Amlicure contain like Kodiki, Brinkaraja, Bhumi Amlaki, Kasini, Punarnava. So conclusion-wise, NAFLD is relevant in India and deserves significant attention. Accurate diagnosis and management are crucial, and this case demonstrated Ayurvedic treatment combined with the necessary lifestyle changes can fully reverse the condition. However, this is a single case study. Further research with a larger sample size is essential and effectively elevate the social and economic impact of NAFLD. So references, thank you.
Congratulations for your very good presentation. The important thing is you have included Platen and Amlicure DS.
Yes.
They are the patent drugs.
Yes, sir.
So you have taken this permission from the government department, ethical permission.
From where, sir?
For clinical trial of these drugs.
No, sir. Actually, this was given in our OPD only.
Yeah.
Yeah. The same OPD case I have presented.
The second important thing is, while you are narrating such type of the studies, Ahar is an important role. Ahar plays an important role. Akale chate matram chahi asatmam yach bhojanam mithya aharam ityukta sadatam parivarjayet. Akal bhojan is very important. Yes. Matrapat bhojan, kal bhojan, that is very important issue.
Yes, sir. I have mentioned.
You have mentioned over here. और मात्रा निर्धारण करने के लिए आपको बताना पड़ेगा कितना खाएं कैसे खाएं. तो मात्रा अग्नि के सापेक्ष मात्रा होती है और उस अग्नि के सापेक्ष भी सबसे इम्पोर्टेंट चीज है कि दो भागौ पूरे अन्नम तोए एकम प्रपूरयेत वायु संचारणार्थाय चतुर्थम अवशेषयेत. 4 हिस्से इसके स्टमक के करें, एक हिस्सा 2 हिस्से सॉलिड फूड से भरे, एक हिस्सा लिक्विड से भरे और रिमेनिंग ये खाली छोड़ दें जिसकी वजह से आपको ये प्रॉब्लम्स क्रिएट ना हो. इट्स वेरी इंपॉर्टेंट. ये सब लोगों को जरूर बताना चाहिए. इट्स वेरी गुड प्रेजेंटेशन.
थैंक यू सर.
Elastography or your is it elastography or USG only?
USG, sir. Ultrasound. Yes.
Because in fatty liver, elastography is a very good parameter where you can have a very.
Yes.
In the next cases, you do that and it will have a very good impact.
Okay.
Dr. Abhijit, I must compliment you. Excellent presentation.
Thank you, sir.
Just take it as an addition.
Yes, sir.
I think I've missed out. Did we anytime do ECG? There was shortness of breath.
Yes, sir.
There was
Sir, because of anemia, sir. Because of anemia.
Okay.
Yes.
Okay, that
yes,
was
yes.
okay.
Because she was not a known case of hypertension. She was taking more than salty food, more upar se bhi dal ke, more than 12 gram per day. It is reduced to 5 gram per day.
That is why
yes,
cardiac
yes,
angle
yes.
was. Thank you.
Yes, sir. Thank you, sir. Thank you.
Thank you, sir. Now, I invite Dr. Kiran Kumar Reddy, sir, for the presentation on the topic Management of Recurrent and Complicated Fistula in NO with Apamark Shartela.
Good afternoon, everyone. Off and on the stage. Myself, Dr. Kiran Kumar Reddy, working as an associate professor in the Department of Shalajantra in this hospital. Today, my topic is my case presentation, management of recurrent fistula in NO with Kshara Sutra and Apamarga Kshara Taila in modified technique. So, introduction, when it comes to the fistula nano, so fistula nano is nothing but it is a tubular connection between external surface and anal canal. So, this is the anal canal. This place is called as a dentate line. From here, there will be some crypts will be there. Cryptoglandular infections. These glands get infected and they will convert into abscess. This abscess searches for the pathway to go outside. So it will prepare a pathway somewhere, like a volcano. Okay. So there it opens somewhere in this manner. These are different types of fistula nano. One comes like this, like a Worcester creevy. Another comes this L shape, one straight. Different angles are there and different shapes are there. Based upon that, classification is different. So finally, the past classification says that the main cause for fistula nano is cryptoglandular infections that leading to the abscess, laterally leading to the passage formation, which is called as a fistula. So why Bagandra is so special? Bagandra is so special, especially in the anorectal region. Why? Because Acharya Srivastava also considered it as one of the Ashtamahagadhas because it has a lot of complex presentations, high recurrence rate, and post-op complications like incontinence of feces, etc. will be more in Bagandra than Arshas and fissure or perianal abscess. Next, management of fistula in nano. There are many treatment modalities available for the management of fistula in nano. Surgical. In that, surgical is the main important one. Why? Because medicines can change physiology, but they cannot change already formed abnormality in the anatomy. So to correct anatomy, it needs surgical interventions. So in surgical interventions, there are different modalities like fistulectomy, fistulotomy, set-on placement, which we call it as a Kshara Sutra, ligation of intersphincteric fistula tract, fibrin glues, through which glue will be added into the passage and close the passage, advanced flapping, expanded adipose-derived stem cells, etc. All these have been emerged as a standard treatment options for the own. It has its own disadvantages and advantages. So next comes to the Kshara Sutra. So Kshara Sutra is a medicated set-on or thread prepared by using medicinal plants, Kshara, Snugikshira, all those things. It is widely accepted as a standard treatment modality for the management of fistula nano, and it has revolutionized the surgical management of fistula nano. However, there are some difficulties while practicing conventional Kshara Sutra therapy in the complex fistula nano. It leads to the discomfort, post-procedural pain, repeated hospital visit, and few recurrences will be there, and this causes more inconvenience to the patients. With considering to the past concept of a fistula manifestation, anal fistula can only be cured by destroying the infected crypt so that the rest of the tract will heal by itself. So now coming to the case I want to present. So this is the case. This case is a male patient who is 42 years old, visited our surgical OPD with a recurrent fistula nano with external opening at 9 o'clock position and internal opening at 6 o'clock position respectively. He underwent fistulotomy twice in allopathic hospital, and he was admitted. Later on, he came to our OPD because of reference by some other patients orally. So when he visited our OPD, we have admitted him, we have operated him, and we have put him in the Kshara Sutra application treatment. And it took near about 10 weeks to complete the course of treatment by Kshara Sutra replacement once in a week. So every week we are going to change Kshara Sutra. As the track length is 10 centimeters, it took almost 10 weeks for us, near about 2 months. So even after 10 months, everything is healed. So I thought that the chapter is closed, I can take rest. Suddenly, by surprise, the fistula again erupted. It's like a Bahubali movie ending. Everything was fine. Suddenly, Katappa killed Bahubali. Nobody knows why. So next comes surprise. So with a span of 15 days, primary external opening site is opened with presentation of a discharge pus leading to the recurrence of the fistula nano for third time. Now I am upset. Patient was upset. Everyone is upset. So I told the patient, go to the allopathy doctor. Just I want to get rid of him for 1 week because I need to take some breath. So I want to plan something for the future. So next, what to do next? So I started evaluating what are the causes of the recurrences, apatya, ahara vihara, improper tools for the surgery, or no regular follow-up or improper interpretation of the track. So in that, I got only 2. Apatya, ahara vihara, patient was very obedient. He used to follow whatever I say. Next, no regular follow-up. He was very regular, so I cannot blame him. There must be some problem with either surgical method or from my part. That is improper tools for surgery or improper interpretation of the tag. So this is the case, the diagrammatic representation real image. Probes. whatever the probe we are using for probing from external opening to the internal opening, they are all made up of metals. These metals are copper, bronze, steel, gold, silver, whatever we can use. So probe is usually made up of the copper, silver, gold, and can also be used for flexibility. What happens usually is these are not much flexible, so that it cannot go through the track properly. So we will do some false passages leading to the recurrence rates. Okay. So there is a limitation for flexibility of the probes also. Then what is the solution? Solution is that a substance. I want to search in a substance which can treat it. So substance I searched is which can track the passage, which does not create false passage, which can do the function of Kshaar Sutra, which will not cause any complications. Among all these, I got these four: Kshaar Sutra, Ksharvarti, Prasarniya Kshara, and Kshar Tela. So I have selected the green color, that is Kshaar Sutra and Kshar Tela. Why? Because remaining two are not applicable in this condition. So final destination of the treatment plan is that I have planned all this in 1 week. So two options were available. One is Kshar Sutra and Kshar Tela. So I have decided to use both of them with Yukti Pramana, because it was not given in any of the references, neither Aptopadesha or anywhere. So assessment of consequences. So I have assessed what will be the consequences if I do this. Next, I have modified the technique of intervention. So we split the fistula tract into the two parts. Proximal 6 centimeters of the tract we have treated in another way, and next 2 centimeters I have given. This was the diagrammatic representation. So this is the fistula tract. Usually what we do is we pass the Kshar Sutra from here to here and tie it until it cut through. So later, these are the probes. So later what I modified is, I have divided this track into two. Till here 1 centimeter, remaining track is 6 centimeters. So this 2 centimeters I have put a Kshar Sutra. From here I have been pushing Kshar Taila. So Kshar Sutra cleanses the Shodhana of the cryptoglandular infection. It will tackle internal opening at 2 centimeters of the tract. Kshar Taila will tackle remaining 6 centimeters of the tract. Length of the tract was 8 centimeters, proximal 2 centimeters and distal 6 centimeters. Deshpande probe, reverse probing has been done and artificial opening has been created. So I have created an artificial opening, this one. So from here Kshar Sutra is there, here Kshar Taila is there. So both are doing at a time their own work. First one is Kshar Tela. For the first two steps, hydrogen peroxide betadine is used for flushing the distal 6 centimeters of the tract with the help of 5 ml syringe from the external opening. From the third day, Kshar Tela, 2 ml once in a day. So first day Kshar Tela passed freely, second day Kshar Tela passed difficultly, third day it was not passing, there was obstruction, I pushed it forcefully, and the fourth day nothing was going on. It means that the track is being closed completely. Within the span of 6 days, the 6 centimeters track has been closed completely. Usually it will take 1 centimeter for 1 week. Within 6 days, 6 centimeters has been cleared. Next is the results are like this. So the results are, this was the external opening. I am very bad at collecting the data. So this was during the treatment. It was not previous to the treatment. So this was the final result. Nothing was visible. Everything was fine, like nothing has happened. So conclusion is that Yukti Sarvopari hai, complex and lengthy fistula tracts are difficult to treat, causes more pain and inconvenience to the patient till it is cured. Some alternative interventions has to be combined. Techniques as done in this case may change the scenario amazingly. The patient is happily doing his job since 3 months without any morbidities, signs and symptoms. I am very heartfully thankful to the patient who has given patience and confidence in me. Thank you.
One thing I would like to ask you, is there any medication you have given orally to the patient?
Yes, sir. Since 3 months that medicines were going on, but it did not give any impact on the patient. So once the case has been failed or recurrence was there on the third time, I sent the patient for the allopathy treatment they have given clindamycin and all those antibiotics for 1 week. But it did not give any result. So patient came again after 15 days.
Triphala Gugulu is supposed to be having a wonderful role.
Yes, sir.
In the as a post
during first 3 months, Triphala Gugulu and Gandakrasani was going on, sir.
Right.
But it did not yield. Why? Because the procedure itself is very lengthy and complicated.
आपने युक्ति प्रमाण का प्रयोग करके अच्छा काम किया. आपने एक क्षार तेल का यूज किया, इधर आपने क्षार सूत्र का यूज किया. तो क्या क्षार सूत्र, क्षार तेल is equally effective?
हाँ, sir. I want to discuss everything, but because of
could it be replaced by क्षार सूत्र?
No, sir. It cannot be replaced.
क्षार तेल से नहीं कर सकते?
No, sir. Why? Because Kshara Taila is acting equal efficacy as Kshara Sutra, but the problem is that if we are pushing Kshara Taila from external opening, it will go into the internal opening and it will spread the anal canal leading to the proctitis ani. So I don't want to get that. So I have done a bypass surgery there, by which Kshara Taila will come outside and the track will collapse.
Window method is recommended by Professor P. J. Deshpande and BHU.
Yes, sir.
Okay, it's all right.
Thank you, sir.
Thank you, sir. Now, I invite Dr. Preeti Pandey, ma'am, for the presentation on the topic idiosyncratic adversity reported after oral consumption of an Ayurvedic formulation containing bhallatak, a case report.
Good evening, everyone. Myself, Dr. Preeti Pandey, Assistant Professor here at GGIMS. And thank you for Scientific Committee. Thank you, Scientific Committee, for giving me this chance to present my case paper. My topic is idiosyncratic adversity reported after oral consumption of an Ayurvedic formulation containing bhallatak. Okay. I just want to explain the basic need of this case. Firstly, people around us usually think that Ayurvedic formulation doesn't create any harm, doesn't do any side effect, but this safety assumption makes an important role to play to opt their Ayurvedic treatment for their disease. That's why, but the possibility of drug-related complication or drug-related adversity is always remains either the patient take formulation with proper schedule or with proper doses. And here my case is idiosyncratic drug reaction, and this idiosyncratic drug reactions are different from ADR, adverse reaction. Because ADR, in idiosyncratic drug reactions, there are late onset of adversity related complication and late manifestation of normalization of the symptom after withdrawal of incriminated drug. And those who doesn't know about idiosyncrasy, idiosyncrasy is a term in which most of the audience is a student. That's why I want to explain the idiosyncrasy. Idiosyncrasy means any abnormal physical reaction to a particular individual with a particular drug or a particular food. Here is my case. In my case, a 21-year-old male called Sunil, diagnosed with axial spondyloarthritis and ankylosing spondylitis, based on his clinical features and his MRI report of sacroiliac joints and his hematology, biochemistry, and immunology, all reports. In his MRI, his right-sided sacroiliac is present. CRP is more than 92.71, and his ESR was 44 at that time when he came to our PD. And okay, and at that time, we prescribed the small quad 30 ml, and according to his clinical features, he was already diagnosed with ankylosing spondylitis, and from our Ayurvedic perspective, he is simultaneously diagnosed with a clinical feature like Amvar. So we prescribed the classical treatment of Amvar. Dashmul Quad 30 ml 2 times a day, Amvatari Ras 125 mg 2 times a day, Amrit Bhallatak 2.5 gram 2 times a day, and Sanjeevani Vati 125 mg 2 times a day. Okay. Initially, from the treatment up to the 6th or 7th day, patient is well responded to the treatment. But after 8th day, he started feeling increased pain and stiffness in his back. But 3 to 4 days went on, and after that, he developed tiny red rashes on his flexor surface of both arms. And later on, after 1 to 2 days, these tiny vesicles are gradually converted into papillovesicular rashes. Without any association of burning, itching, and not any constitutional feature like fever. Although patient complained pain in deglutition with this. And when he came to me and reported all these things, we immediately stopped the medication. After 4 days, just stop the medication, patient, these rashes become disappearing. And after 5 to 6, there is a complete. This is the important events. Sir. Sir, 10th को he complained कि increased pain and stiffness. 13th को when सारे investigation again done, he was HLA-B27 positive. 16th को he developed papillovesicular rashes on flexor aspects of both arms. Then 17th, Sanjeevani Vati and Amrit Bhalatak stopped. Actually, I stopped all the medication, the smooth, Sanjeevani Vati, Amrit Bhalatak and everything. But rashes started disappearing. 17th को जब संजीवनी वटी और अमृत भल्ला तक रोका था, उसके बाद दशमूल क्वाथ एंड रेस्ट ऑफ द मेडिकेशन कंटिन्यू करने को बोल दिया था, क्योंकि पेशेंट स्टिफनेस और पेन से भी परेशान था. फिर 21st March को rashes started disappearing and 27 March rashes completely disappeared with post residues. On 17th April, patient is symptomatically improved and doing well. And this is 10th August. And before I coming out, the last time he actually, sir, this was the picture. This is the last follow-up when he came to me. All the rashes completely disappear, no itching, no pain, and patient is symptomatically improved. Our clinical condition of that time of clinical condition of that of patient at that time was 70% improved. उसने रिटन में मुझे ऐसा दिया था लिख के. आई एक्चुअली ट्रांसलेट इट इन. उसने पूरा बताया था जब से उसने मेडिकेशन स्टार्ट किया था अप टू दैट पॉइंट जब मैं वहां से आई थी. एंड एक्चुअली दिस इज द स्पेशल केस, क्योंकि ये इडियोसिंक्रेटिक ड्रग रिएक्शंस है विच इज डिफरेंट फ्रॉम एडीआर. इडियोसिंक्रेटिक डिफरेंट एडीआर से क्यों है? क्योंकि लेट ऑनसेट होता है पेशेंट में और पेशेंट का जो एडवर्सिटी आती है उसका भी लेट ऑर्गेनाइजेशन होता है. इट विल टाइम. और इसमें एक ड्रेस DRESS करके है, ड्रग रिएक्शन विद इस्नोफिलिया सिस्टमिक सिम्टम्स. ये पहला ऐसा पेपर है जो भल्लातक के साथ इसने एडवर्सिटी कॉज की है. और अभी तक तो ड्रेस को केवल HLA-B27 पॉजिटिव पेशेंट विद कार्बामेज़ेपिन एंड अदर ड्रग्स के साथ रिलेट किया गया था. दिस वाज फर्स्ट पेपर ऑफ माइन इन आयुर्वेदा जहां ड्रेस सिम्टम्स को भल्लातक के साथ प्रेजेंट किया है. Thank you so much.
There are three terms:
Sir.
hypersensitivity,
Sir.
intolerance, and idiosyncrasy.
Sir.
What is the difference between all the three?
Sir, idiosyncrasy is an abnormal physical reaction.
Unexpected.
Sir.
Reactions.
Sir, and a particular individual with any food or any drug or any kind of foreign particle.
Yeah. You have reported this case in the pharmacovigilance cell?
Sir, actually, this was published as the JIM. I was an MD student.
Actually, it is expected from the all researchers. Once you are noticing anything, आयुर्वेद के बारे में जो कॉन्सेप्ट बना के रखा है, कोई रिएक्शन नहीं होता.
रिएक्शन नहीं
बिल्कुल होता है. अब हमारी फार्माकोविजिलेंस सेल एवरीवेयर वी आर वर्किंग, so it should be reported.
Yes, sir.
Positively. So
that's why adversity reported in Ayurveda it's most important other than treatment.
You said you put him on, I think 3 or 4 drugs. Am I right?
Yes, sir. Dashmul Quad.
Okay. Just for my information,
sir,
one of them was Balatika, है ना?
Sir.
One of the drugs.
Sir. सर एक्चुअली दीज टू जो दोनों ड्रग मैंने विड्रॉल करी थी वो अमृत भल्लातक अवलेह था और संजीवनी वटी ऑल्सो कंटेन भल्लातक. तो हमने दोनों एक्चुअली हमने सारी मेडिसिन
विड्रॉल बंद कर दी.
यस सर. फिर आफ्टर 4 days जब पेशेंट का सिम्टोमेटिक नॉर्मल हो गया तो आई री इंट्रोड्यूस दशमूल क्वाथ ओनली एंड अदर फोर्थ वन ड्रग संजीवनी वटी एंड भल्लातक. इसको विड्रॉल इसलिए किया क्योंकि ये तो नोन है कि भल्लातक से पेरिएनल इचिंग होती है एंड पेशेंट ऑल्सो कंप्लेन अबाउट इचिंग एट पिनाइल एरिया, तो इसलिए उसको विड्रॉल किया. और इसको कंफर्म करने के लिए आफ्टर ये 17 अप्रैल के बाद इसको फिर से संजीवनी वटी री इंट्रोड्यूस किया एंड आफ्टर 2 days ही अगेन कंप्लेन कि मैम पेरिएनल इचिंग इज persist.
That you have not mentioned in this case.
Sir, only 5 minutes we have, so I just.
No. Whatever
sir, it is a complete
important
paper.
part of case report. Na?
Yes,
See,
sir.
You have tried to withdraw a particular drug, feeling that this could have been the reason behind this, and then
we have to reintroduce
again
Yes,
reintroduce, and again you found some reaction. It may not be the idiosyncratic, but it was definitely adverse
yes, sir.
reaction.
Yes, sir. It would be
So-
further confirmed.
That was. Thank you.
Thank you, sir. Sir, it's my pleasure to present in front of Tomar, sir.
Thank you, ma'am. Now, I invite Dr. Rashmi Bhatt, ma'am, for the presentation on the topic Role of Shodhan in Medo Dosha with special reference to dyslipidemia.
Respected dignitaries on the dais and all the PG scholars and all faculties and UG scholars. Myself, Dr. Rashmi, Assistant Professor from the Department of Rogunidana and Vikriti Vignana, Social Ayurvedic Medical College. I'm going to present a case report on Samprapti Vighatana in Medo Dosha with special reference to dyslipidemia. Now, Samprapti Vighatana Meva Chikitsa, there's a verse, right? So, in Samprapti Vighatana, how it can be done, that I'm going to discuss in further cases. Now coming to the Medo Dosha, right? Medo Dosha, we will get reference in Sharangadhara Samhita. It is Medo Vriddhi Janita Dosha or Ashtasaulya Dosha. So how to know Medo Dosha in an individual? We can know clinically also or through investigations. So what is Medo Dosha? It can be Baddha Medas or Abadha Medas. So Abadha Medas is Margaga Medas that can be included under dyslipidemia. So Medo Pradoshija Vikaras include Madhumeha, Staulya, Prabhrateha, etc. disorders, and we know Mula is Vrika and Bhavana. Now, Swadosha Sankranti, that's an interesting concept. One dosha will vitiate other dosha. Similarly, one srotas vitiate the nearby srotas. So Medas will vitiate the upcoming srotas and causes Daruna Vikaras, which include Prameha, Pidaka, etc. disorders. So this is the Samprapti of Prameha Pidaka. So with this background, I have encountered a case, male patient of 52 years from Jodhpur, complaint of multiple swelling in bilateral lower limb since 3 years, breathlessness for the past 1 year, which is progressively increasing, and fatigue and weakness since 6 months. And this is the Vedanta. He was healthy 3 years ago. Then past 3 years, patient developed firm, non-painful 5 to 6 nodules on bilateral lower limbs, which have progressively increased in size. And 6 months ago, the patient started experiencing episodes of breathlessness on exertion, which gradually worsened over time and is now present even at rest. There's no history of chest pain or palpitation. And the patient reports episodes of fatigue and generalized weakness, along with reduced physical activity due to breathlessness. There's no significant history of weight loss or chronic cough. And about past history, patient is known case of diabetes mellitus, hypertension, recently diagnosed. History of coronary artery diseases, angioplasty 2 years ago. Then known case of dyslipidemia on medicines. And significant history of hypertension and diabetes in both parents. And about Vaiktika Vrittanta, appetite increased, sleep disturbed due to breathlessness, bowel has to, rest of the things normal. Samanya Pariksha, appearance obese, built overweight, then BMI 28, overnourished. Then about the Samanya Pariksha, edema, bilateral repeating edema, then nodules form 5 to 6 non-tender nodules, 1 to 2 centimeter in diameter in bilateral lower limb, mainly on the anterior aspect. Nothing significant, systemic examination. Ashtasthana Pariksha, Mala was irregular, Akriti was Staulya, Pramana was Pravara, Dashavidha Pariksha. Now after the history taking, now let us go to the investigation for the confirmation of the diagnosis. So we can diagnose the Medo Dosha through fasting lipid profile. So in this, LBS, PBBS was more, HbA1c was more, and we could able to notice dyslipidemia in this patient. Interesting thing, HDL was decreased. Now, let us do the Samprapti Vighatana of this case. Nidana, along with the Bija Dosha, patient had history of Avyayama, Divaswapna, Madhura Rasa, Ahara Sevana, Madhya Sevana continuously. Pururupa, Shota, Shwasa Kruchata, and Rupa, Pidaka, Swasha Kruchata, and Ayasa. Upashaya, nothing significant. Samprapti
of the Gataka, dosha is Vata Kapha, and Dushya Rasa Rakta Mamsa Medas, Abada Medas, Agni, both Chataragni and Dhatwagni. So based upon this history and diagnosis, I have diagnosed this case as Medodosha and Prameha Pidaka in the initial stage. Now let us concentrate on the treatment. So definitely we are supposed to follow Shodhana Chikitsa in this patient. Now which Shodhana should be followed? Tikshna Shodhana should be followed. Among this, we can do three treatment: Ulekhana, Vamana, Virechana or Raktamoshana. I have adopted Virechana Karma in this patient. So 10 days of Virechana treatment, 3 days Langhana, followed by Snehapana 3 days, Gugulutikta Girta and Mahatikta Girta 4 days, then Abhyanga Svedana, then Virechana, Trivratleha, then Samsarjana Krama for 5 days has been given. After 15 days have given Medha Kapha Kshaya causing medications, Asanadika Kshaya, Kaishwara Gugula and Gandhaka Rasayana. And this is the diet chart of the patient. Along with this, I have followed the deep relaxing techniques of during the Virechana and post Virechana also. This is after the treatment. Interestingly, HDL, it was decreased, increased. Then FBS changes, cholesterol and LDS, we can notice changes. So these are all the pictures during the Virechana Karma. After the treatment, after Virechana, then lastly, after 15 days of Virechana Karma. So definitely, in such a case, we have to follow being Roganina student. Definitely, Nidana Parivajana should be done. After that, treatment, we have to focus on Dosha Prathanika Chikitsa, Vata and Kapha. Then we have to concentrate upon Agni, definitely Jataragni and Dhatuvagni. And Tikshna Shodhana, Katutikta Kashaya, Dravya should be adopted for Shodhana. Conclusion, yastu roga visheshajnaha sarva bhajya kovidaha desha kala pramanajnaha tasya siddhi asamshayam. Definitely with proper diagnosis, proper treatment, if we know the knowledge of desha kala and pramana, if we treat, there is no doubt that definitely there will be 100% success in the treatment. I want to thank my principal, Dr. Alok Rai sir, Srivastava Ayurvedic Medical College. Then lastly, I want to thank my guru, Dr. Gorakshnath Acharya sir. I'm a student of Gorakshnath sir, STMC Udupi. Finally, I want to thank the organizers of HITAYU community. Thank you.
इसमें कोई खास बात नहीं है। मेदोरोग जो है ना, तो इसने जो कुछ भी किया है तो पेशेंट टू पेशेंट निर्भर करता है। अब मान लीजिए कि पेशेंट का बॉडी वेट यदि 50 kg से कम है, तो हम फोर्स नहीं कर सकते कि इसको वमन कराया ही जाना चाहिए। तो कुछ केस जो होता है उसमें हाइट किया जा सकता है। तो आपने ये हमको बतलाया कि आपने तो विरेचन कराया, तो पेशेंट का बॉडी वेट कितना था?
पेशेंट का बॉडी वेट अराउंड 70 kg था।
तब तो फिर आपने बहुत गलती कर दिया। 70 kg का है, मेदो रोग है, तो उसका तो फॉरमोस्ट ट्रीटमेंट वमन होना चाहिए था।
सर डेफिनेटली वमन करवाना चाहिए था। मुझे भी बताया वाता कफा इन्वॉल्वमेंट पर कफा इन्वॉल्वमेंट वमन है।
कुछ नहीं होता है, वो जो है बहुत कुछ लाइन में जो लिखा हुआ है उसको हमको क्या करना है कि रोग जो है सो मेदज रोग है और पेशेंट भी मेदोज ही है। तो उस हालत में यदि आप इग्नोर करेंगे तो काम नहीं चलेगा। वी हैव टू टेक ड्रास्टिक एक्शन अगेंस्ट द डिसीज। और आपने सॉफ्टनेस काम किया, आपको ड्रास्टिक होना चाहिए।
नोन केस ऑफ कोरोनरी आर्टरी डिसीज, तो मैंने लाइक वमना का रिस्क लेना चाहिए।
नहीं, जब आयुर्वेद से आप क्या करते हैं कि कोरिलेट कर रहे हैं, तो यू कैन नॉट एस्केप बाय स्पीकिंग कोरोनरी हार्ट डिसीज।
एंड इवन आई हैव नोटिस द इन्वॉल्वमेंट ऑफ रक्त इन दिस पेशेंट। सो मैंने
दूसरा चीज क्या है, 70 kg का वो पेशेंट है, तो आपको विरेचन भी नहीं कराना चाहिए कि विरेचन के लिए नियम ही बना हुआ है कि वमन कराकर विरेचन कराना है। ऑलरेडी मैं एक स्पीकर को मैं बोला था, तो वही चीज आप पर भी लागू होता है।
जरूर सर।
स्नेहन स्वेदन वांताया दद्यात् सम्यक विरेचनम, अन्यथा ग्रहणी गद के दोष क्रीडमतम, ग्रहणी आच्छादित कथम ग्रहणी गद क्रीडमतम। तो आपने इसको भी इग्नोर कर दिया। तो जो केस जो है राशनल, सभी लोग 5 से ज्यादा मेडिसिन यूज कर रहे हैं, हम चाहते हैं कि पिन पॉइंट मेडिसिन होना चाहिए, राशनलाइजेशन ऑफ द मेडिसिन। हमारे गुरु प्रोफेसर बीवीएस शास्त्री बोलते थे, आइदर पैसा गवर्नमेंट का हो या किसी का हो, एक पैसा भी मिसयूज नहीं होना चाहिए, फालतू का इन्वेस्टिगेशन नहीं होना चाहिए, और फालतू का दवा भी नहीं लिखना चाहिए। और आप तो हमारे भी गुरुकुल से है, मेरा भी गुरुकुल बेंगलोर है, मैं भी ईश्वर रेड्डी का स्टूडेंट हूँ।
9 बजे तक।
तो आपने नाम सुना ही होगा ईश्वर रेड्डी का। तो गुरुकुल के प्रति मेरा भी श्रद्धा है, और गुरुकुल का आदमी यदि गलत करता है तो जानबूझ के गलत करने वाला अक्षम्य होता है। इन फ्यूचर मस्ट।
सर मैं एग्री करती हूँ, आप जो बोल रहे हैं 100% एग्री करती हूँ। हाँ सर। और मैं क्या सोची कि एक तो पेशेंट कार्डियक पेशेंट है सर, एक शुद्ध चिकित्सा कैसे होता है कि पेशेंट को हार्म ना करे, तो मैं वो सोच के विरेचन प्लान किया। उसमें भी तीक्ष्ण नहीं देना चाहिए, मुझे पता है पेशेंट का सत्व बल इतना अच्छा था, तो मैंने सोचा विरेचन प्लान किया जाए। और उसके साथ इंटरेस्टिंगली हमारा कैंपस ऐसा है कि योग भी करवाया जाता है, उसमें डीप रिलैक्सिंग टेक्निक्स अलोंग विद विरेचना डीआरडी करते हैं, अलोंग विद द डाइट भी फॉलो करते हैं, लेकिन जब विरेचन करते हैं हमारा डाइट, लकीली जब मैंने विरेचन दिया पेशेंट वाज रिस्पॉन्डिंग वेरी वेल, तो मैंने विरेचन प्लान किया। और रक्त का भी इन्वॉल्वमेंट मैंने सोचा था। और एक बात है, पेशेंट शरद ऋतु में आया था, सो आसन्न मार्ग से निकालना अच्छा है, ये मैंने सोचा।
A very good case presentation, number one. And secondly, I think there are standard modalities of treatment, no doubt, as sir has pointed out. At the same time, the modalities need to be at times adapted to particular patient requirements, and patients differ from one patient to another. So no patient is alike to the previous patient that you have seen. So I appreciate your well-meaning adaptation of the modality of treatment, and that has produced results also at the same time. So congratulations.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you, ma'am. Now, I invite Dr. G.S. Thomas, sir, to give a brief note on the sessions.
As a chairperson of the session, I would like to congratulate all the speakers. They have presented the paper in wonderful way. Being a teacher, I must appreciate them. Give a big hand to all presenters. Confidence in the students. मैं देख रहा हूँ कि बच्चों के साथ जो प्रेजेंट करने वाले आए हैं, they have got the wonderful subject matter. But to concise, to limitize the presentation within the appropriate time, that is equally important. And it's a very important discipline. While that the person has been given a time of 5 minutes, so you must conclude the whole thing. जो इंट्रोडक्टरी पार्ट होता है उसको हमको इग्नोर करना चाहिए, और ये मान के चलना चाहिए। याद रखिए कि you must know your audience. All the teachers and students sitting over here, they know the fundamental basis of the subject. So you need not to spoil your time on this particular thing. बहुत अच्छा प्रेजेंटेशन रहा सभी बच्चों का। और बेसिकली एक चीज मैं आपको बताना चाहूंगा कि बड़े इंपॉर्टेंट टॉपिक्स आपने लिए, जैसे अभी क्षार सूत्र की बात आई, तो दीज आर दी सर्टेन ग्रे एरियाज वेयर द आयुर्वेदिक मेडिसिन कैन कंट्रीब्यूट अ लॉट. The Ayurveda Day is celebrated as an innovation. Ayurveda innovation for global health. So Ayurveda innovation for global health in this perspective, the role of the Ayurveda in chronic and intractable diseases, especially in the lifestyle related diseases. So here we can contribute a lot. So while we are studying these important things, so we cannot ignore all ethical issues. They are equally important. And as far as the pharmacovigilance cell is concerned, ये दिमाग से निकाल दीजिए कि आयुर्वेद की दवाई का कोई साइड इफेक्ट नहीं होता. several side effects are noticed. और इसका कारण क्या होता है? The preparation of the medicine is very important. हम लोग कहते हैं दवाई कैसे बनाई जाती है. One of the pharmaceutical comes to me when I was holding a post of the principal कि हमने पारस का शोधन कैसे करते हैं, मरकरी का प्यूरिफिकेशन कैसे करते हैं. बोला साहब सल्फ्यूरिक एसिड में डाल देते हैं और प्यूरिफाई हो जाता है. तो दिस इज वेरी इंपॉर्टेंट थिंग. The following of the process given by the classical texts with the modern technical technology, the involvement. मैं अमेरिका जा रहा था एक सेमिनार में, तो मेरे साथ कैलिफोर्निया मेडिकल स्कूल की फार्मेकोलॉजी की प्रोफेसर ट्रेवल कर रही थी, और वो मेडिकल प्रोफेसर जो थी वो बीएचयू में विजिट करने आई थी. उनको इरिटेटिंग कफ हो रहा था, कंटिन्यूसली बहुत तेज खांसी आ रही थी. तो मैंने परिचय हो गया था, तो मैंने अपना वो बैग खोला और मैं हमेशा लवंगादिबटी रखता हूँ, और मैंने लवंगादिबटी उनको दिया. मैडम यू च्यू इट. तो 6 घंटे की ट्रेवल में हम लोग जा रहे थे. 6 घंटे की ट्रेवल में उनको एक बार भी कफ का बाउट्स नहीं आया. जब उतरने के बाद में, जब न्यूयॉर्क एयरपोर्ट में हम उतरे, तो हमसे कहा कि डॉक्टर तोमर यू हैव गिवन मी सम मेडिसिन. व्हाट इज द नेम ऑफ दैट मेडिसिन? हमने मैडम इट वाज लवंगादिबटी. ओ व्हाट आर द इंग्रेडिएंट्स? मैंने कहा तुल्या लवंग मरचा फलत त्वचेसु सर्वे सबो निगृता खतरे से तारा और बबूर प्लस कषायुतम चूर्णम कासा निहंत गुटिका घटिका कांते. ओ माय गॉड, वेरी वंडरफुल, वेरी डिफिकल्ट. तो माय डियर फ्रेंड्स, जब आप शुद्ध दवाई बनाएंगे नहीं, काली मिर्च की जगह पपीते के बीज मिलाएंगे, तो हाउ यू कैन एक्सपेक्ट द सेम इफेक्ट्स ऑफ द मेडिकेशन. तो ये फार्मास्यूटिकल्स का दोष है. इसलिए हमको फार्मेको विजिलेंस सेल में जरूर रिपोर्ट करना चाहिए. और दूसरी बात, पेपर्स के बारे में मैंने देखा कि बहुत अच्छा पेपर था. जो आज के मॉडर्न जो आपके एरा है, जैसे आपका नॉन एल्कोहलिक डिसीज देख रहे हैं, हर तीसरा चौथा बच्चा, और अमेरिका की पोजीशन तो ये है कि एवरी थर्ड अमेरिकन इज ओवरवेट. वो इतना ज्यादा खाते हैं कि अभी हम सोच ही नहीं सकते. तो ओवरवेट है, और ओवरवेट होने से ऑस्टियोआर्थराइटिस का एपिडेमिक है. तो मैं विशेष रूप से कहना चाहूंगा कि इन ऐसे एरियाज में, जिस इंस्टीट्यूशन में आप काम कर रहे हैं, तो केस रिपोर्ट इज वेरी इंपॉर्टेंट. एक केस का पेशेंट का भी प्रेजेंटेशन करके आप पब्लिश कर सकते हैं. पब्लिश और पेरिश, लेक्चर और लीव. कोई चीज आप करते हैं तो उसको पब्लिश करिए, और अदरवाइज लेक्चर दीजिए, और नहीं तो भूल जाइए. इसलिए हर चीज को रिकॉर्डिंग होना चाहिए और वो काम करना चाहिए. मैं बहुत बहुत बधाई देना चाहता हूं विशेष रूप से इसके ऑर्गेनाइजर्स को, हमारे प्राचार्य जी को, कि पूरी टीम को बधाई देना चाहता हूं कि बहुत अच्छा कार्यक्रम ऑर्गेनाइज किया, और इन लोगों ने प्रेजेंटेशन किया. इनके अंदर जो स्किल डेवलपमेंट है, जो अच्छा काम कर रहे हैं, उनको मैं बधाई देता हूं. आगे इसी डिसिप्लिन, जिसे अनुशासन कहते हैं, अनुशासन से आप काम करेंगे तो और वो अच्छा काम कर पाएंगे. बहुत बहुत धन्यवाद, बहुत बहुत धन्यवाद.
Thank you, sir. Now I invite Dr. Arvind Kushwaha, sir, to give a brief note on the session.
मैंने पहले भी बताया था, जैसे कि डॉक्टर तोमर के बाद अगर कोई बोलने आएगा तो उसकी स्थिति क्या होती है. तो मेरे को जब ऐसी स्थिति में डाला जाता है तो मुझे सोचना पड़ता है कि चलिए एक मौका मिला कि सर के साथ बैठने का, बात करने का. आप लोगों के इस सेशन में जो पेपर प्रेजेंटेशन था, मुझे इसमें जो पार्टिसिपेट करने का मौका मिला एज ए जज, मैं इसके काबिल तो नहीं था, बिकॉज मैं आई एम नॉट कैपेबल टू रियली जज यू पीपल, बिकॉज बहुत अच्छा काम आप लोगों ने किया, और जो केसेस थे इसके बारे में मेरी जानकारी बहुत लिमिटेड है. बट जो भी केसेस आप लोगों ने प्रेजेंट किए, बहुत अच्छे कैलिबर के, बहुत अच्छे स्टैंडर्ड के थे, और प्रेजेंटेशन जनरली बहुत अच्छे स्टैंडर्ड्स के थे. तो कॉन्ग्रेचुलेशन टू ऑल दी प्रेजेंटर्स. वो अलग बात है कि अब किसको मार्क ज्यादा मिलेगा, किसको. मैं तो मार्किंग कर भी, मेरे को तो समझ नहीं आया कि मैं कर कैसे पाऊंगा. मैं कर ही नहीं सकता एक्चुअली. तो मैंने सर से बोला, मैंने कहा आप जो करेंगे मैं उसी का नकल उतार के कर दूंगा. वो अलग बात है कि नकल मैंने करना, मैंने सीखा नहीं कभी, तो मैंने अपना जो भी किया है. अभी जो भी इसमें से कोई एक आध फर्स्ट भी आएगा, सेकंड भी आएगा, बट it is important to participate. It is important to present your case. And all the cases were very interesting and very relevant also. और बहुत common हमारी जो OPD setting होती है उसमें इस तरह के cases आते हैं, बहुत ज़्यादा हैं. तो the variety of the cases was immense, बहुत अच्छी थी. Quality of presentation was very good. And I'm really happy to be part of this particular evening session. Thank you very much.
Thank you, sir. Now I invite Dr. Rajesh Behel sir to give a brief note on the sessions.
डॉक्टर तोमर सर, प्राचार्य जी एंड मंच पे बैठे और एक्सपर्ट्स, मैं आई कंसिडर माई सेल्फ वेरी लकी कि ऐसे सेशन में मैं भी बैठा और मेरे को भी कुछ सुनने को मिला, अच्छी बातें हो रही थी, बहुत इंटरेस्टिंग केसेस थे, समझने की पूरी कोशिश करी। जो आयुर्वेदा पार्ट है वो शायद उसमें तो हम लोग नहीं एक्सपर्ट्स हैं, बट फिर भी ये एक जो कंपटीशन की भावना है ये हमेशा रहनी चाहिए। और कभी जो थोड़ा बहुत शॉर्टकमिंग्स अगर कोई शेयर करता है तो नॉट बिकॉज इट वाज अ वेरी वेरी क्लोज फाइट, बहुत ही अच्छा था, सबने अपनी तरह से पूरा परफेक्ट प्रेजेंटेशन किया है। और ये जो जिसमें भी थोड़ा बहुत अगर है तो हाँ, डिसिप्लिन जो है ना वो टाइम, उसकी थोड़ी प्रैक्टिस कर लेनी चाहिए। आई फील कि थोड़ी प्रैक्टिस जब प्रेजेंटर्स करेंगे तो नेक्स्ट टाइम जो है दे विल बी डूइंग इट मच बेटर। और बहुत अच्छा था। यू शुड ऑलवेज मेंटेन दिस कॉन्फिडेंस एंड इन फ्यूचर ऑल्सो participation is more important, and presenting before all these dignitaries, that is matters. Thank you very much. Thank you.
Thank you, sir. Now I invite Dr. Satish Kumar Tiwari sir to brief the sessions.
देखो ये प्रेजेंटेशन तो अच्छा ही हुआ है, तो साइंटिफिक चीज का कलात्मक प्रेजेंटेशन जो है दिमाग में रखना पड़ेगा। वैज्ञानिक चीज है, इसको कलात्मकता से आपको प्रेजेंट करना है। और इसमें एक चीज हम और बोलते हैं कि ये पता नहीं ये क्या समय को हो गया है कि प्रोप्राइटरी मेडिसिन का लोग क्या कर रहे हैं कि रिसर्च के लिए ले रहे हैं, तो क्या आपको अपने शास्त्रीय योग पर विश्वास नहीं है? और शास्त्रीय योग को हम इसलिए प्रेफर करते हैं कि उसका रेट भी कम होता है, प्रोप्राइटरी मेडिसिन का कॉस्ट भी ज्यादा होता है। तो आप लोग को जब पेशेंट को आप देखने जाएंगे तो ये भी देखेंगे कि एक मेडिसिन जो है क्लासिकल मेडिसिन का दाम 2 रुपए जहाँ पर है तो वहां पर प्रोप्राइटरी मेडिसिन का 5 रुपए से ज्यादा ही दाम होता है। किसी भी टैबलेट का दाम 5 रुपए से कम नहीं है, किसी भी प्रोप्राइटरी मेडिसिन का। और आपके पास में इतना बड़ा फार्मेसी है तो आप तो अपनी फार्मेसी में बना सकते हैं। हमने भी एमडी के लिए जो योग बनाया था तो मार्केट से कहाँ लिया, जाके गौशाला से गोमूत्र कलेक्ट करके बाकुची शोधन करके वो सभी जो काम करना था वो काम किया है। तो आप लोग का इससे मतलब होता है कि आप लोग आलस से भरपूर हो गए हैं। आप लोग आलस मत करिए और क्या करिए कि कलेक्शन ऑफ द पेशेंट तभी ठीक होगा जबकि क्वालिटी ऑफ द रॉ मटेरियल ज्यादा अच्छा होगा। और वैज्ञानिक चीज को कलात्मक तरीके से प्रेजेंट करने का तरीका क्या है कि आपका सभी टाइम के अंदर में सब काम हो जाएगा। बस धन्यवाद, प्रेजेंटेशन तो सभी का अच्छा ही था।
Thank you, sir. Now I invite Dr. Girdhar Vedantam sir to brief the sessions.
Respected Tomar sir, Dr. Arvind Kushawa sir, Dr. Bahal sir, Dr. Tiwari sir, and all respected faculty members and dear students. So today we had this session for having more practical approach because most of the people coming are UG. So here our viewers are UG. That's why case is one thing which will give more insight to you than research papers which will come in VAC or somewhere where PG people will be there, faculty will be there. They can understand more. So that's why we kept one case, this case paper session, and it is a more practical way of understanding because we deal with cases and how we need to know. And when we have a case presentation, usually the cases will come with something new. The case may be rare, treatment may be different, or sometimes you have a modification or something change in the treatment of the person who is presenting. So whenever they come, definitely they will have some more insight into the understanding and then planning the treatment. That is the thing which we will get from the presenter. So today we have seen that everywhere all presenters have made a very good presentation when we see what we can understand from there. So just if we see the diseases which are there, cerebral palsy, GP syndrome, PCOS, psoriasis, or this what we call on the lips, there are ulcerations are there, or non-alcoholic fatty liver disease, everything. These are actually, they have a limitation of management. So they have a limitation of management, but still you can see the success here. There is some success. You can't see everywhere 100% success in are there. Recurrence will come in psoriasis, and so these things will be there. But still, we could manage, and patient is satisfied. This is the thing which we can bring through our management. That will give you confidence. So people, the presenters have given you confidence that we can manage such a complicated conditions and come with result. And one of the two things, no, see, Dr. Kiran, I'm not I'm taking, I can talk on all presentations, don't take anybody personally, because Dr. Kiran's, when he has told that, no, so he made a very big thing. Actually, it is not small thing what he has made. See, if we have a track, the track is continuously infected if it is connected to the alimentary tract. This. So he cut it and he made into a smaller tract and managed with the supra. And the other part can be managed because now it becomes a sinus. So whatever may be the large, within 6 days it has. Actually, you have seen in earlier treatment of his Char Sutra, it took 6 months. But when he changed the management, it has been treated in a very small day. So that is where Ayurveda also says, Charaka says, Yukti is the one of the pramana. Why? This is the thing what human being can bring into the treatment. As Sir is telling you, you have to be patient, individualistic management. That is what we have to come with. So this is what we have to come with, and you should understand how these things have to be managed. And everywhere, all people have brought their own intelligence and changed the drugs. They explained why they have chosen, like Ashwati is telling how instead of pitta she managed vata. So you have to think, because everywhere these ulcers are very common. Not treating means then you have to show insight and you have to come with a solution. That is the what where we have to come. So even if a non-alcoholic water, it is not easy to treat. So you saw it even in case of this dyslipidemia. See, if you give any other treatment, can we bring some change in the triglyceride from 300 to 173? Any management in 3 months, it is not possible. Now you see, with a short time, it has brought to 174. That to triglyceride, it will not come normally. That is where the insight and management is bringing. So which we should get from that type of thinking. I appreciate all and thank you one and all.
Thank you, sir. Now, I request Dr. Naveen Kodaleddy, sir, to facilitate the chairperson of the session, Dr. G.S. Thomas, sir. I request Dr. Reshmi Pushpan ma'am to felicitate Dr. Arvind Kushwaha, sir. I request Dr. Gopi Krishnan, sir, to felicitate Dr. Rajesh Behel, sir. I request Dr. Mini Kevi ma'am to felicitate Dr. Satish Kumar Tiwari, sir. I request Dr. G.S. Tomar sir to felicitate Dr. Giridhar Vedantam sir. Now, I request the panel members to felicitate the presenter of this clinical case presentation. I invite Dr. Sandeep Kumar sir on the stage. Dr. Supriya Mishra ma'am, Dr. Netravati B. Aruni ma'am, Dr. Arjun Shashi Kumar sir, Dr. Ashwati madam, Dr. Abhijit sir, Dr. Kiran Kumar Reddy sir, Dr. Preeti Pandey ma'am, Dr. Rashmi Bhatt ma'am, I request Girdhar sir to present the certificate to the session coordinator and the rapporteur.
I request to hand over the certificate to Ms. Kushi, rapporteur of the session.
The session ends here. Thank you, everyone.